From now on, we're going to invite next speaker is Miss Carolyn Santora. She's here. Hi, Caroline. Hi. Thank you for coming here, even though we have a time difference gap. What time is there? Would you please turn on the microphone for me, Caroline?
Hi, yes, it's about 3 o'clock in the morning here.
Oh my gosh, thank you so much.
I'm cozy on my couch. That's why I'm a little in the dark.
Oh, did you have a good dream? Okay, I'm gonna turn on your presentation video to everybody. So I'm gonna introduce quick for you to everybody. Okay, Carolyn Santora, she's Chief Nursing Officer of Stony Brook University Hospital in the United States. Here's to talk about impact of COVID-19 on nursing operation and academic medical center. Please welcome Mrs. Carolyn Santora. She's here, so if you have like further questions and any comments from the panel, we can have a little time just for a few minutes to ask Santora. Is it okay to you, Santora?
Of course.
Yes,
course.
thank you. Thank you so much. Please welcome Mrs. Carolyn Santora's presentation from now on.
My name is Carolyn Santora. I'm the Chief Nursing Officer at Stony Brook University Hospital, and I am so happy to be presenting today. Especially happy because we can once again collaborate with our distinguished and cherished colleagues from Jeju Hala. And I want to thank Dr. Yoon for this opportunity. What I'm going to do now is share my screen. There we go. So my presentation today will discuss the impact of the pandemic on communication at our academic medical center. So what I'm presenting today includes an overview of Stony Brook Medical Center. I'll talk about the local impact of the pandemic and our response to it. I'll discuss the communication challenges and our leadership strategy to address those communication challenges. So a little bit about Stony Brook. Stony Brook University Hospital is a 624-bedded hospital with a very busy emergency department and an active maternal child service. We are located on the east end of Long Island, and for the geography trivia nerds out there, Long Island is the longest island in the continental United States. This is our local New York State COVID-19 tracker. It's showing people tested and positive tests over time. I've highlighted our peak cases at Stony Brook. These coincided with 2,782 cases statewide. You can see those positive cases on the rise statewide at that time. This slide represents the same details, but just for Suffolk County, the county in which Stony Brook is located. Our hospital peaked at 435 inpatients on April 10th of this year. I'll remind you that our total hospital certified beds are 624, and that includes our mother-baby beds, our neonatal intensive care unit, and our children's hospital, in addition, our 3 oncology units. So as you can imagine, we soon ran out of critical care and medical surgical beds for the COVID positive patients. This is our average daily census. The red bars represent our COVID patients. You can again see that peak going into the second week in April. And just a quick update, currently we have treated 1,746 COVID positive patients, and we've had 235 COVID positive deaths for an overall mortality rate of 13.5% as of 10/21. Those are pretty good statistics. It's difficult to compare apples to apples, but from what we have been reading and following, these seem like decent stats. As of the morning of this taping, we had just 9 COVID inpatients, and 3 are in our ICUs with 2 on ventilators. So in order to respond to that rapid influx of patients, we had to create additional units and space. A total of 7 additional units were opened, or space was reorganized to accept the COVID positive patients. We created an additional 87 beds, and we converted another 41 beds to ICU and 53 intermediate level beds. We also added 86 med-surg beds in non-traditional spaces. Our sister hospital, Stony Brook in Southampton on the South Shore, took 30 of our med-surg negative patients so that it freed up space for more COVID positive patients. We installed 96 negative pressure machines for another 96 rooms. This created an environment so that we could place all of these patients in appropriate space. I know there's no one here that would argue with the importance of communication. Our new environment and our rapidly changing processes exacerbated the challenge of communication to all in this large academic medical center. Communication to all levels of staff, to our patients and families, and to our community all had to be considered. The guiding principles was that communication had to be continuous, it needed to be daily, it needed to be just in time as situations changed, and it needed to reach its target audience. So accessibility was extremely important. The first form of communication I'll highlight was the need to communicate with the community. Communications to staff and to our wider community. We implemented a call center that took calls from anyone to answer questions, get the person hooked up with testing as needed, and review symptoms and then refer as appropriate. It takes professional staff to field those calls. So we used nurses who we redeployed from other areas. These were nurses who were either immunocompromised or are pregnant nursing personnel who wanted to continue working, and they came to man our call center. You see them pictured here. And by the way, all 3 of those pregnant nurses, they've now given birth. Those are our call center babies, and those babies share a bond forever, and they're all doing really well. This is the data out of that call center. You can see that our peak calls coincided with our peak admissions the 2nd week in April. They fielded almost 800 calls that week. And to date, as of April 28th, they've completed over 5,000 calls, and they remain open. You can see the daily volume has dropped, but now we're starting to get more calls again. And these are coming from students and teachers as both the university and the public school systems have opened up once again. As the chief nursing officer, I felt my obligation was to ensure that I was personally communicating with the nursing staff. This particular communication that you see on this slide was done in the form of a letter, and that was done purposely that way so that it could be printed and posted on the units, but it was also sent via email, and then it was also sent to people, these staff members' homes. This letter went to our redeployed staff. I wanted to ensure that the nursing staff was reached and that the voice was mine. So this letter addressed the nurses that we would be redeploying from other areas to cover the increased staffing needs of the pop-up units. As you can imagine, that was extremely anxiety-provoking in those nurses. But I sent the letter to everyone, not just the nurses that were going to be redeployed. And that was important so that every nurse could see what we were doing in order to support them as they were taking care of our patients. What I've highlighted in this slide is this one excerpt. It's the very last paragraph in the slide. And what I'm saying to these nurses is that I am confident that you agree with me that it will be an honor to come alongside our colleagues already on the front lines of this battle to serve our patients and our community in this monumental effort. I'm confident that when this is over, this will have been Stony Brook Nursing's finest hour. And I must say that is exactly what it turned out to be. And you can see some of those redeployed nurses with other nursing staff working shoulder to shoulder, side by side throughout this. Early on, it became evident that our attempts to communicate, while well-intentioned, were not reaching the frontline staff. We posted daily updates on our homepage, but people weren't going to our homepage when they got to work. And they would ask as I walked around, how many patients do we have? Is anybody going home? Is everyone dying? The truth was our frontline staff were not coming in and surfing the internet to get to our homepage or the intranet. They were in their patients' medical charts. Some maybe were scrolling through emails, but they were really too busy to be looking at the homepage. So I created the Hope Report, which was something that would be pushed to them email. And this was in an attempt to reach the frontline nursing staff and to bring them hope through reporting daily on the numbers of admissions, but also on the number of patients that were being discharged. And yes, patients were really getting better. We needed to tell them about that. How many patients were being extubated? The first Hope Report, which is shown in this slide, was sent on April 8th. And that was actually before we peaked. It was meant for the nursing staff, but the nurses soon shared it with others, and those folks started contacting me and asking to be added to the distribution. It soon went to a distribution of well over 1,000 recipients, including all nursing staff, all department heads, executives, and then anyone who asked to be put on the list. The other thing that the Hope Report did was to provide a forum for the staff to submit stories, and then they started to submit TikTok dance videos. I'm going to click on this one for you. So a little bit of silliness, but that silliness was important. And soon everyone was sending those dance videos. It became a real competition. They came from everywhere. They came from our physician residents. They came from patient advocacy staff. They came from facility staff. They were fun. They made people smile. They brought joy at a time when we were all really in need of that. So some of the comments I received on the Hope Report were these, and I must say that there has not been many things this gratifying to me than being able to do this during this time. I sent the report every day, including weekends, well into the end of August. And then starting in September, after Labor Day, I began the Hope Report weekly. So now it's a recap of the previous week. It still gives the numbers of admissions and discharges, but we're now also looking at trends over the week time, and it provides a cautionary tale in some ways when we start to see the numbers going up a little. And, you know, we vow never to go back there. And then there were the challenges of communicating to the patients and their families. In an era when we were trying to minimize the time any individual spent in a patient room, and when we were in the rooms, we were wearing masks and gowns and face shields. So how do you connect with those patients? When there were no visitors allowed in the hospital, how do you communicate with frightened families? How do you link the patient to the family? So we needed to develop novel mechanisms to communicate, and we wanted to project hope to the patients and their families. And I'm going to share another short video with you.
COVID hit really hard and fast in New York, and we were suddenly giving care like we never gave care before. Everyone had to wear PPE. You were totally covered. Everybody looked the same. Everybody had a mask covering their face. We almost looked like a group of robots walking around. Nobody could tell who anybody was. We had a nurse practitioner who realized that this was very frightening for the patients. And in the interest of bringing some humanity back, she developed this concept of this face behind the mask. She took a selfie, blew it up, put it on a piece of paper, added her name and who she was, her role. And she also added the words, "I care about you." What we call now the face behind the mask. People love them. It not only identified it for the patients, but it identified us to each other also, which was also very important. Patients were delighted, and I believe that this is one of the reasons. If you look at our HCAP scores during COVID, they went way up. And I think this is one of the reasons. So we had these terribly sick patients, most of them on ventilators, and so sick that you weren't having a lot of communication. And we really didn't know anything about the patient except their diagnosis, their disease, their medical history. We had actually a previous process in place called My Story that we use for our dementia patients. And we would get stories about the dementia patients and bring them to the staff so the staff could use them when they were interacting with the patient. So we built on that and we created these storyboards that included pictures of the patients and stories about them. It was so impactful, both for the nurses who took those stories and for the patient families. They were so delighted. They couldn't be visiting their loved ones. They felt like they couldn't do anything, and here was something they could do, and they could tell the story of the patient. And the families sent over pictures. We put it on a poster to be put up outside the patient room, so that the staff knew not just the name of the patient, but what this patient did, what they liked to do, and things that were important to them. It changes the way you take care of someone when you know something personal about them. When they woke up and saw those pictures, they were so delighted to know that we cared about them at that personal level, that we went through the trouble to do this for them. We became their families. The we're all in this together aspect of this was something that's priceless. That personal and human connection is so important to the patient. It's important to the families, but it's just as important to our staff. It keeps us in touch with why we're doing what we're doing. It's the human touch that keeps us coming back to was an incredibly difficult work during this time. Work like I've never seen before in my career. Work that could be soul draining and actually was sometimes soul draining when it goes on day after day. But the human connection makes us stronger, it makes us better practitioners, it makes us wiser. When all is said and done, we just give better care when it's personal and when it's human.
Communicate to the patients and each other was simple. Take a black marker and write on the windows to the rooms. We had actually cut into many of our solid doors to allow for windows so that we could view the patients from the outside. This also gave a natural surface to write on. The black Sharpies came out and we wrote messages and reminders to other staff and to ourselves. But as you can see here, we also wrote backwards on that glass to communicate to the patient. The picture on the right is of two nurses in one of our ICUs on this patient's birthday. They're holding and singing happy birthday with the patient's family at home. We became family members, we celebrated with them, we mourned with them through iPads and tablets and cell phones. We found ways to communicate. Along with the Daily Hope Report, we also had very low-tech ways to communicate hope to the staff who walked in every day. We had these whiteboards at our entrances. So as soon as you came to work, you saw that patients were being discharged and COVID patients on ventilators were being extubated and getting better. During the day, we, like many other hospitals, came to start playing songs to celebrate and notify the staff that patients were getting better and going home. So we played Here Comes the Sun over the intercom. That signaled to all staff that a COVID positive patient was being discharged. And the patients who were alert would ask, what is that? So every time they heard the song, they too had hope. We chose Here Comes the Sun because we had heard of other hospitals using that song. And we felt we wanted to be in solidarity with them. After all, we were all in this together. This was occurring all across our nation. But towards the end of the time that we were doing this, we switched because everyone was becoming tired of hearing that same song over and over and over as more and more patients were discharged. We didn't stray too far from the concept. We chose Good Day Sunshine instead, which is also a Beatles song and also Stony. For extubations, we played chimes overhead. Every time the chimes were played, respiratory therapists all over the house cheered. And once again, hope and joy was brought to the staff and patients through a simple communication mechanism. To ensure the voice of the nurse was heard, nursing leadership created centralized and decentralized support. Our usual centralized nursing office with off-shift supervisors remains intact. But to supplement that, we created a schedule of 24/7 nursing leadership. This was done with our departmental directors called AVPs. In some places, we call them associate directors, and our nurse managers, who on a rotating basis, along with our clinical nurse specialists, covered the house 24/7. They rounded to bring support, to hear issues, to troubleshoot, and to make sure our staff understood that we were truly all in this together. They were visible and they were accessible. They recognized stress and they celebrated when appropriate. This is a picture of Nurse Recognition Day. We celebrate that in the United States in May. It celebrates Florence Nightingale's birthday. And for all of us, we were still at the height of our pandemic in New York. We are all in this together. And this concept, there's a concept called radical interdependence that fits this situation so well. Never before were we more dependent on each other. We're dependent on our colleagues, on our community, on our leadership. We're dependent on what others had learned across the nation and across the world and how to deal with this pandemic. So this picture that I'm showing you is just one of many. There's a picture like this from each unit, and they were spontaneously done, and they were shared on social media and then in our Hope Report. I don't think I ever experienced such solidarity as I have during the peak impact of COVID. One of the other remarkable stories of another state hospital for us, which was located in upstate New York, they supported us because they had much lower levels of COVID patients at that time. And remarkably, a group of nurses from SUNY Upstate volunteered to come and work side by side with us. These were experienced, talented ICU nurses. They left their families, they left their homes, and they came down to Long Island. Later on, respiratory therapists and pharmacists joined them in an amazing show of solidarity and dedication to mission. We're forever grateful for them. And this is a picture of that, some of those nurses with our staff. So I'll end this with a virtual hug and a great big thank you. And I hope you can come back to us soon so that we can update this picture. Thank you, Jeju Hala.
Thank you very much for your wonderful presentation, Caroline. I remember the picture, it was 2 years ago. Please say, yes, please say hello to them. I miss them.